Okay, so for this first scene, the scene unfolds in a dental office where Miss Smith arrives for her routine appointment that she's been coming to every 6 months. However, at today's appointment, it takes an unexpected turn after the hygienist had done a couple of her assessments. The temporary dental hygienist there for that day, Alex, steps in for her friend and covering her shift, and then she quickly realizes that Miss Smith's periodontal condition has significantly worsened since her last documented examination 2 years ago. So this discovery leads to an ethical dilemma requiring careful decision making and communication with the hygienist and the patient. So next we're going to see the interaction between the hygienist and Mrs. Smith.
Good afternoon, Miss Smith. How are you feeling today?
I'm feeling good. I'm just here for my regular cleaning, and I'll never miss an appointment. So
Okay, that's great. So today should be really quick and easy for us today.
Yep.
So we're going to start your examination. We're going to wash my hands with some gloves on real fast, and we're going to get started, okay?
sounds good.
Okay. How long have you been coming to this dental office?
Probably about 2-3 years.
Oh, good.
Yeah. I like the doctor. They're pretty cool.
So I'm going to go ahead and recline you backwards.
Okay.
Is that okay for you?
Yeah, fine.
Okay, let me get my light so I can see. Okay. I'm just gonna be checking some pocket depths and checking your calculus.
After the assessments were done, the hygienist then explains her findings with the patient. The hygienist currently went over the periodontal status and the necessary steps to Miss Smith, who is very upset in the moment. The ethical dilemma here involves a stark of contrast between the patient's diligence, attendance, and the lack of proper documentation and monitoring with the hygienist that she had been seeing. This is all news to Mrs. Smith. She thought everything looked healthy and clean, and surprising to her because she had been coming in every 6 months for a routine cleaning with no knowledge of periodontal disease at all.
During today's examinations, I found some issues that need immediate attention. Despite your consistent dental visits, your periodontal condition has worsened significantly.
Well, what do you mean, though? I've been coming to my appointments pretty regularly for my cleanings, and I thought everything was fine.
I understand that this is unexpected and concerning. Your last periodontal charting was 2 years ago, showing localized periodontal pockets and slight to moderate bone loss. Today, however, I observed stage 3 bone loss and active 6 millimeter pockets, which indicate serious progression of periodontal disease.
But I don't understand how this could happen. I've been so diligent with my appointments.
So now the conversation concludes with a plan in place to address Mrs. Smith's periodontal health. The hygienist's ethical decision making and compassionate communication will help Miss Smith through this challenging discovery and to ensure her that everything will be okay, that the hygienist there will do what she can to prevent any future progression of the disease, as well as informing Miss Smith what she can do to stop the further prevention of this disease.
Is it possible that some aspects of your periodontal condition were not adequately documented or monitored over time? We need to address this immediately to prevent further damage. I will provide you with detailed information and work with you on a treatment plan to manage your condition.
Yeah.
I know this is distressing, Ms. Smith, but it's crucial to address this now. We need to perform a comprehensive periodontal assessment and possibly refer you to a periodontist for special care.
I just can't believe this is happening. I was expecting a routine cleaning and a clean bill of health.
We will do everything we can to manage this condition and improve your oral health. I'm here to support you through this process. I'll also review your dental records to understand what might have been missed and ensure we document everything accurately from now on. Ms. Smith, we will also discuss any changes in your medical history or lifestyle that might be contributing to your periodontal condition. Together, we will create a plan to address all of these factors. So now that I'm finished with your assessment, based on your current medical history, there's a few questions. It says that you're not diagnosed with any medical conditions or taking any medications. Is this still correct?
No, I've actually been diagnosed with hypertension and rheumatoid arthritis. I just didn't really think it, pertained, I guess, to dental hygiene. I didn't think it really mattered, so I didn't tell her. And then I've also been taking corticosteroids as well for the past 2 years.
Oh, okay. So based on your medical history, I just want to let you know that systemic diseases play a huge role in the progression of periodontal disease. Were you aware of that?
No, I was not.
Okay. Oral hygiene is important, and here are some oral hygiene instructions. And just want to let you know that nutrition also plays a part in your oral condition as well. Just to give you a bit of information on the steroids, the corticosteroids that you're taking, it can decrease bone density by reducing calcium absorption and increase bone loss, which apparently you have been experiencing. And it can be a factor in tooth loss and increase pocket dent. So I'm going to go over just I'm going to go over some Ori-Ties with you. Okay. So we're going to use this little demonstration here. And I'm also going to refer you to get a water pick or a toothbrush that has a water system in it, just to help with cost too, and just making it more efficient for you. So this is one of the options that we have for the toothbrush, but it comes with a water floss. So I want you to brush with the bristles aiming towards your gum line, just to help with your gingival margins and your tissues. This also should help, with keeping the bacteria down and the plaque buildup in the back. Also, you're just going to keep doing that all around.
No, I'm putting it in the front.
And go down to the bottom line.
Okay.
And for your tongue, just always remember to brush your tongue as well. We do see white coated tongues a lot. Just mean like the plaque is sitting on your tongue. Just need to brush those really good. A tongue scraper is also good for that as well. You can do that for 1 to 2 minutes, just how long until you feel comfortable, until it gets white. Clear for your plaque. Another alternative, since you are taking the corticosteroids, maybe try vitamin D for the bone and vitamin C for calcium, just to help with more calcium in your system. And for let's go over our dental treatment that we kind of planned out for you. We're going to do a full medical history just to make sure that we're not missing anything medical wise for you. A few intro and a extra oral exam. X-rays if needed. We're going to do a full new perio chart. Update your hard tissue, and we're going to recommend that you get an SRP, just a deep cleaning in your terms. And after your 4 to 6 week re-eval treatment, if you still have 5 to 6 millimeter pockets, we're going to refer you to a periodontist, and he or she will just specialize more on your bone loss and tissue.
Okay.
So that last video kind of concluded what was going on in the last couple minutes of the appointment. The hygienist quickly went over everything that she had found within her assessment. She found that there was active periodontal disease, 6 millimeter pockets, and also generalized calculus subgingivally. So the hygienist did her part by explaining to the patient what she found and possible reasons why she found those and how things could have been misdocumented from the previous hygienist. She did it in a way where it was very professional and didn't seem like she was blaming that hygienist for those mistakes. She kind of just said, we will do our part from this appointment moving forward and doing what we can to prevent the further prevention of the disease. So once she explained that to the patient started to understand it a little bit more and felt a little bit more comfortable and reassured. Then the hygienist quickly went over medical history, made sure everything then was up to date, made sure that the medications were put in, any systemic diseases and things like that, and then explained to the patient why those systemic diseases could also have been a factor to her periodontal health and making her periodontal health worsen over time. And then they went ahead and went over a treatment plan, what the hygienist was going to do with that patient. She was going to do her 4341, which is an SRP, all 4 quads. They're going to go ahead and do that treatment. and then they were going to go over assessments before that treatment, make sure everything was thoroughly done. And then after that, they were going to refer her over to a periodontist if needed at her 4 to 6 week, depending on how the pocket depths looked at that appointment. And I think at the end of the appointment, Miss Smith felt a little bit more reassured when she came into the appointment initially and realized that her periodontal health was worse and that she didn't even realize that she had bone loss or anything like that. It was a shock to her and obviously made her very upset. But I think the way that the hygienist handled the situation by explaining to her the importance of all the assessments and to make sure that they're very thorough, and how she kind of reassured her that we will do our part to make sure that things don't get worse and that we will take care of you. And if you need anything, just to let us know as a hygienist. And the way that she went over oral hygiene instruction to the patient, so the patient feels more confident in her abilities at home so she can do her part to help prevent. Okay, so now regarding the question on what is the ethical dilemma in this situation. So in this situation, the main ethical dilemma revolves around the discovery of the significance of this periodontal disease in a patient who has been very diligent in her oral hygiene, has been coming in every 6 months like she was supposed to. Despite her consistent visits, her periodontal condition has worsened substantially, and there's a lot of documentation and monitoring in her dental records that have not been put in, like her medical history, systemic diseases that she has, medications, correct perio charting, and things like that. This situation raises concerns about the quality of care that she has been receiving from the previous hygienist, whether her condition could have been managed more effectively with proper documentation and possible follow-up appointments and explanations to the patient on how her overall oral hygiene looks.
In this ethical dilemma, for the development of a treatment plan, we will collaborate with the patient to create a comprehensive treatment plan, involve referrals to a specialist, frequent monitoring, and specific interventions to manage periodontal disease.
Okay, so now for question number 3, what ethical principles are involved in this case? So the 4 main ethical principles involved is non-maleficence, the principle of doing no harm. So the patient not being aware of her current oral hygiene status and the hygienist not being able to explain to her or letting her know that she does have periodontal disease into the extreme of her disease. So the patient or the hygienist must ensure that the patient receives appropriate care to prevent future periodontal damage, which she did not make the patient aware of. Second is beneficence, so acting in the patient's best of interest by providing necessary treatment and interventions to manage the periodontal condition. So the patient was coming in every 6 months receiving just a regular prophy when she probably should have had some type of SRP based on the current status of her periodontal findings, which that was the active periodontal disease, the 6 millimeter pockets, and the generalized subgingival calculus. And after that SRP was done, she should have came back for either 4 to 6 weeks, a reeval, or came every 3 to 4 months for her perio maintenance appointments. And then the third one is veracity, being truthful and transparent with the patient about her condition and the necessary steps for treatment, which was not discussed with the patient. She was not aware of anything that was really going on. She thought that she was healthy and everything was fine. And then the fourth one is justice, ensuring that the patient receives fair and quality care, including proper documentation and monitoring of her periodontal health. So that was also not done. Her medical history and her probing assessments were not put in. And there were several things that needed to be put on her medical history that the hygienist was not aware of, like her rheumatoid arthritis, the hypertension, and her taking the corticosteroids, which does contribute to periodontal disease. So that's very important for the hygienist to be aware of. So the hygienist can explain how the patient can do her part and how the hygienist can do their part to prevent any future progression of the disease.
There are multiple legal implications involved in this case. The original hygienist inaccurately filled out the patient's medical history by failing to discuss the patient's medical conditions and medications. She also has not been updating the perio chart in over 2 years, even though the patient had been coming in regularly. Both of these ethical mistakes could put the hygienist and dental office at risk of being sued and ultimately the hygienist losing their license. The patient has every right to sue the hygienist because the state of her oral health has been declining over the past couple of years, even though the dental team was telling her everything looked great. It is important the temporary hygienist updates all the patient's records so they are correct, document the patient's negative reaction to the truth, and report the original hygienist to protect herself. Other factors that should be considered when making ethical decisions in this case should be the relationship between the original hygienist and the temporary hygienist, the dentist's role, and the patient's role. Ethically, I would not report the hygienist before hearing the full truth of why the patient's records are not up to date. I would have a conversation with the dentist as to why health records and period charting have not been made a priority, as well as with the hygienist to see if the patient was previously asked about any health conditions. In a case this extreme, it is important not to assume any information before jumping the gun to report them. Once the hygienist has gathered all the correct information, they can then present their ethical dilemma to the board while still protecting themselves and their license.